In this video, we will discuss some unique cancers that arise due to mutations in a kinase protein causing constitutive activation of a proliferation signal and uncontrolled cellular growth. The recent discovery of the specific mutated kinases special to each of these cancers has allowed researchers to develop small molecule kinase inhibitors for use as therapy. These drugs soon revolutionized the treatment of these diseases and now allow most patients to have a much improved quality of life. And what better backdrop for these revolutionary treatment discoveries than the political upheaval surrounding the American Revolution? Most people remember July 4th, 1776 as the day the Second Continental Congress met in Philadelphia and officially adopted the Declaration of Independence. You know, Independence Day, right? Well, history gets a little hazy here. It turns out that nearly a month would go by before the actual signing of the document took place. So what actually happened on the 4th of July? Well, most historians believe an initial version was signed, at least by John Hancock anyway, the president of the Congress at the time. But here's what really happened. As the rest of the delegates waited for their turn to sign, John Hancock was in the middle of inscribing his overzealous and unnecessarily large signature when, doink, the nib of his quill pen snapped right off. And as you'll soon see, that broken nib stands for kinase inhibitor. The first rebel group of small molecule inhibitors we'll discuss blocks tyrosine kinase. Each of these drugs ends with the suffix tinib, imatinib for example. That's T for tyrosine and nib for kinase inhibitor. Recall that our recurring sketchy symbol for a tyrosine kinase is a tire swing. So, up on the wall of the Pennsylvania State House, this self-appointed Congress has hung a painting that depicts the most well-known story from George Washington's youth. Yeah, you know the one, remember? He chopped down that cherry tree and his dad was like, "Come on, son." But then George Washington took full responsibility. Never really happened. Well, it turns out that cherry tree had a tire swing in it too. Yeah, no one ever told you that part of the story, did they? An inhibited tire swing, just like an inhibited tyrosine kinase. Oh look, here's one of the founding fathers now, mocking the pose of King George III. "Oh, look at me, I'm a doodle dandy." While his friend looks on, laughing hysterically. Oh, how droll. Let his spot-on imitation of the king remind you of imatinib, the first of our tinib small molecule tyrosine kinase inhibitors. Speaker of the Pennsylvania Assembly, Isaac Norris, first ordered a bell for the bell tower in 1751 from the Whitechapel Foundry in London. It didn't last long though. In fact, it cracked on its very first test ring. So, local metalworkers John Pass and John Stowe melted down that bell and cast a new one right here in Philadelphia. Oh look, the new bell was just sent over this morning. Yes, a shiny new Liberty Bell to ring in the inauguration of a new nation. Wait a minute, it's broken already? What a jip! Well, maybe it's not that bad. Yeah, you know, like on closer inspection, if you just kind of rub it. No. Well, at least it serves as a perfect reminder that the kinase inhibitors in this sketch are used in cancer chemotherapy. A cancer crab is our recurring sketchy symbol for cancer, of course, and that crack right through the center. Well, let's just say we're going to be focusing on fighting cancer. Imatinib, for example, targets a specific mutated tyrosine kinase that's associated with chronic myelogenous leukemia, or CML. Look closely at the patriotic-themed packaging peanuts spilling from the box. Pinkish, white, some bluish ones. Remember that CML is characterized by unregulated growth of myeloid cells leading to increased levels of mature granulocytes of all types, including eosinophils represented by the pink granules, basophils, the blue granules, and neutrophils, the white granules. The old red, white, and blue. Specifically, imatinib is a potent inhibitor of the tyrosine kinase domain of this weird BCR-ABL fusion protein, or often called BCR-ABL. BCR-ABL is signified here by the unheeded warning slapped onto the side of the delivery box. Breakable. Yeah, blame the delivery guy. Shoddy peasant stow craftsmanship. Ridiculous. The most common cause of CML is a translocation between chromosomes 9 and 22. The ABL proto-oncogene is transported from chromosome 9 to chromosome 22, where it's placed adjacent to the BCR gene. The resulting oncogene, BCR-ABL, codes for a fusion protein with constitutive tyrosine kinase activity. This protein stimulates the proliferation of granulocytic precursors and leads to the development of CML. Fittingly, this new truncated chromosome 22 containing the BCR-ABL gene is called the Philadelphia chromosome, hence the address of the Pennsylvania State House in Philadelphia displayed prominently on the box. Diagnosis of CML almost always requires the presence of the Philadelphia chromosome, which is found in up to 95% of patients. It turns out that imatinib also inhibits other tyrosine kinases, including c-KIT found in some gastrointestinal stromal tumors. You see that little stationary kit being held open for the revolutionaries to sign the Declaration? Notice that it's labeled Congress, kind of like Congress kit or c-KIT. Also, as a reminder that the c-KIT tyrosine kinase is found in GI stromal tumors specifically, the kit is propped up on a large, somewhat tumorous belly adorned with a few fashionable cancer crab buttons. It's that crab symbol again. So much symbology. Like you suddenly realize you're in some kind of Dan Brown novel or something. Is this one of those eerie Freemason things? A side effect of imatinib therapy is fluid retention that can lead to ankle and periorbital edema. And if you take a look at our imitating forefather, you can see that his pants have become quite baggy and edematous above those tight yet strikingly fashionable stockings. Alright, to find the next small molecule tyrosine kinase inhibitor, you're going to have to squint your eyes a bit through that window there. You see him? Spying on the proceedings? It's the royal governor, the Earl of Tinib, who's starting to suspect that some kind of revolution is afoot. You rebel scum. This British Earl represents erlotinib, a small molecule inhibitor of the tyrosine kinase domain associated with epidermal growth factor receptor, or EGFR. He's even got his name embroidered onto his hat. Joffrey. Joffrey. Party pooper. Notice that his name contains the letters EGFR. EGFR is overexpressed in a number of solid tumors, including non-small cell lung cancer and pancreatic cancer. Activation of the EGFR signaling pathway results in uncontrolled cell growth, proliferation, metastasis, and angiogenesis. To emphasize erlotinib's use as a first-line treatment in non-small cell lung cancer specifically, his badge is in the shape of a cancer crab and it's located on one of the absurdly large lung-shaped lapels of his overcoat. That's no small crab, Joffrey. And while crawling around outside through the shrubberies to spy on the founding fathers, it seems he's developed a reaction to something out there. Cutaneous adverse events to EGFR inhibitors are frequent due to the abundant expression of EGFR in the skin. The prototypical rash is an acneiform eruption as evidenced by the acneiform spots on Earl Joffrey's skin. Another toxicity associated with erlotinib therapy is diarrhea, as evidenced by the streak of mud that has accumulated on Earl Joffrey's pantaloons. I hope that's mud. He has been camped out there for quite a while, I guess. Diarrhea is very common in patients receiving small molecule EGFR tyrosine kinase inhibitors, although it's not usually severe. Well, we're going to move on from EGFR inhibitors, but be sure to check out our next video covering anti-cancer monoclonal antibodies, where we'll meet a few more agents that block EGFR. Alright, take a look out the other window and you'll see two more small molecule tyrosine kinase inhibitors. Sunitinib, represented by the rising sun, like the rising sun of a new nation, and sorafenib, a soaring bald eagle over that rolling American landscape. It's almost too majestic. This is staged, right? Where's that music coming from? These agents inhibit multiple receptor tyrosine kinases, including vascular endothelial growth factor receptor, or VEGF-R. VEGF is one of the most important angiogenic growth factors, and inhibition of the VEGF signaling pathway inhibits the growth of new vasculature that is required for primary and metastatic tumors. Here, VEGF-R inhibition is represented by this steadfast American farmer chopping down those growing vegetables with his hoe. Veggies for VEGF-R. Sorafenib treats renal cell cancer and hepatocellular cancer. Sunitinib also treats renal cell cancer as well as gastrointestinal stromal tumors. Renal cell carcinoma specifically is represented here by the bilateral cancer crab buckles holding up his suspenders. The multi-targeted tyrosine kinase inhibitors sunitinib and sorafenib are associated with a variety of cutaneous effects including hyperkeratosis and rashes. Just think of this farmer here with hyperkeratotic calluses from working the fields and a skin rash from that oppressive sun. All VEGF-targeted agents have been associated with an increased risk of hemorrhage, as depicted here by the bleeding wound on our farmer. Just gotta hoe through the pain sometimes, you know? Targeting VEGF-R on the surface of endothelial cells disrupts cellular function and increases susceptibility to bleeding. Once again, I want to remind you to check out our next video because we're going to be covering a few anti-cancer monoclonal antibodies that also block VEGF-R. Alright, the last small molecule kinase inhibitor you'll find in Independence Hall is vemurafenib, represented by Benjamin Franklin here. Ben was a diplomat, inventor, even a philosopher of sorts, but did you know he was also a bit of a cartoonist? And as usual, it looks like he's a bit distracted during the proceedings here, and is at work on his first political cartoon depicting the powerless severed snake, stressing the importance of colonial unity against the British. Join or die. Look closely at the fangs of the snake and you'll notice the copious amounts of venom produced by the fangs, venom for vemurafenib. The name vemurafenib contains that nib suffix we keep hearing, indicating that it's a small molecule kinase inhibitor of course, but notice it's not a tinib. Instead, the rafenib suffix should remind you that this small molecule inhibits the BRAF protein kinase. BRAF is depicted here by the first letters of Ben Franklin's signature, BFRA. What in the? Now inhibited by that broken nib. BRAF, or BRAF, is a protein kinase involved in the activation of the signaling pathways that drive melanocyte proliferation. BRAF mutation V600E, valine to glutamic acid, is seen in 40 to 60% of patients with melanoma and leads to greatly increased activation of melanocyte growth, survival, and metastasis. This V600E mutation is even reflected in the prefix of the drug name, vemurafenib. The V600E mutated BRAF inhibitor. Metastatic melanoma is represented here by the disseminated splotches of inky pigment staining Ben's stately overcoat. Okay, someone's really got to look into getting some higher quality nibs around here. Vemurafenib has significant anti-tumor effects in patients with advanced stage V600E positive melanoma and leads to improved survival and long-term outcomes. You know, I think Thomas Jefferson said it best. When in the course of neoplastic events, it becomes necessary for one small molecule to dissolve the tyrosine kinases which have driven the cells to proliferation and to assume among the powers of the earth. Will you cut that out? Look, it's pretty self-evident that not all tyrosine kinase inhibitors are created equal. I mean, there's imatinib, an inhibitor of the tyrosine kinase domain of the BCR-ABL fusion protein, think BCR-ABL breakable, like the Liberty Bell over here. This is all caused by a translocation between chromosomes 9 and 22, resulting in excess tyrosine kinase activity, which leads to the proliferation of myelocytes seen in CML. Remember those red, white, and blue granules. Imatinib also blocks the c-KIT tyrosine kinase, which is found in GI stromal tumors. The Earl of Tinib, that's erlotinib, is an inhibitor of EGFR. The soaring sorafenib and sunny sunitinib, those inhibit VEGF-R. Benjamin Franklin over there, instead of a tyrosine kinase inhibitor, he represents a BRAF kinase inhibitor, vemurafenib. Remember, that's BRAF for Ben Franklin and vemurafenib for that venomous afenib snake. Vemurafenib treats the disseminated ink spots of malignant melanoma. Alright, for our last sketch, we're going to cover anti-neoplastic monoclonal antibodies. That means we're going to be moving from NIBs to MABs.